Welcome to our presentation on cognitive theory. The first question is, what is cognition? In our textbook, cognition is defined as higher ordered thinking. With that higher ordered thinking, we attach meaning to our experiences. We determine what we admire, what we imitate. We determine what we value, and ultimately it determines how we behave in a given situation. Cognitive theory helps us understand how these cognitions influence our beliefs and our behaviors. Whether we realize it or not, in any given situation we have a thought, corresponding belief about that thought, and then that influences how we behave in response to that situation. So in practice, using cognitive theory, you build a good client-therapist relationship, you're goal-oriented, you emphasize the present, and it's educative, meaning it gives skills for identifying, evaluating, and responding to the thoughts and beliefs that we have. And it helps to change that thinking, the moods that we have, and our behaviors. And as we seek to understand all those things, we can strive to have better outcomes in any given situation, and it can help improve our moods, we can improve the quality of our social interactions, and we can decrease the anxiety within ourselves.
Cognitive theory is used in a variety of settings and with diverse populations. The most familiar from a child welfare perspective are with schools, homes, residential facilities, and outpatient services. Cognitive theory is used in schools by day treatment workers and school social workers. Intensive in-home programs are often based on cognitive theory. In addition, residential programs use cognitive theory for many of their interventions. Many issues are addressed using CBT, such as anxiety, depression, OCD, and eating disorders. Two of the most familiar models used in outpatient services are TF-CBT and AF-CBT. Trauma-focused CBT is typically used in a clinical setting and has been shown to help children, adolescents, and their caregivers overcome trauma-related difficulties. Alternatives for Family CBT, previously known as abuse-focused CBT, is also generally seen in clinical settings. AF-CBT has been shown to be effective in physical abuse cases.
Cognitive therapies have been shown to be an effective intervention across diverse populations. For example, they are used in prisons, jails, community mental health centers, and in various programs in the criminal justice system, such as addiction and restorative justice programs. Few people understand the flexibility of cognitive theory better than those providing CBTP, P's for psychosis, to those who present as homeless with psychotic disorders such as schizophrenia and bipolar disorder with psychotic features. Clinicians are finding that CBTP allows individuals an opportunity to explore the validity of their bizarre thought content associated with psychoticism. There are a few barriers to where cognitive theory can be used. The criminal justice system, homeless shelters and camps, addiction programs, and community health centers are all places where cognitive theory can be applied.
Cognitive behavioral therapy, also known as CBT, has been proven to be effective and a popular tool in social work practice. CBT can be useful in treating a large variety of clientele with varying mental health diagnoses. Langer and Letts explained one of the strongest benefits of choosing CBT is that it has been established through extensive research evidence as effective for anger management, depression, and other psychiatric disorders. CBT has demonstrated positive effects for children, adolescents, young and middle-aged adults, and older adults. Gregory shared that CBT was also found effective in treating clients with anger, marital discord, persistent pain, depression, and various anxiety disorders. Spirituality or religious practices are also not a barrier in providing CBT to clients. CBT professionals spend time establishing rapport and collaborating with their clients. Through that process, the counselor can easily incorporate the client's spiritual beliefs into CBT practices. Hodge and Letts stated, spiritual beliefs and practices from clients' spiritual belief system are used to convey the underlying therapeutic concepts that are hypothesized to to promote health and wellness. The broad diversity and versatility of CBT is an undeniable strength and is one of the reasons it is such a favorable social work practice. As stated previously, CBT can be utilized in treating diverse client systems. For example, CBT can be used in substance abuse treatment. This therapy helps clients identify self-defeating thoughts and behaviors that drive addiction for many clients. Many substance abuse programs have a strong dependence in spirituality to assist with ongoing recovery. It was found that spiritually modified CBT was perceived to enhance outcomes of social support, divine coping resources, and spiritual motivation, and that is extremely helpful for recovering addicts.
Just as cognitive theory has its strengths, it has its limitations as well. According to Langer and Leitz, one limitation is that it focuses on individual functioning, looking at the individual and its closest systems, which can be an issue for those working in the meso and macro practices. Another limitation mentioned by Langer and Leitz is that the methods in cognitive theory give the social worker too much authority. Hayes recognized that another major limitation is that cognitive theory focuses on the present, which leaves out the cultural differences in upbringing and world experiences that may not be apparent to a social worker of a different culture. It also doesn't consider the impact of racism or other forms of oppression that can affect the client. Also, due to the scientific nature of this theory, alternative ways of thinking, worldviews, and differing ways of interacting are often devalued depending on the therapist's sensitivity to other cultures and ways of being. Although cognitive theory may be beneficial for many because it is viewed as simplistic and works to eliminate symptoms, if used irresponsibly, it can go outside of our NASW Code of Ethics and lead to a reduction of clients' rights to self-determination and autonomy.